Hello everyone, my name is Christine Lee Talang, and today I'm going to demonstrate to you or do a return demonstration in a proper way of draping a Mayo table and at the same time counting and handling surgical instrument. Okay, so of course, the first thing we're gonna do is for the assessment, we have to make sure that we go ahead and count the number of sharps, number of sponges and instrument that we're gonna use before the surgery, and at the same time, you also go ahead and maintain the sterility of the Mayo table and the Mayo stand. That is all throughout the procedure, okay? And then for the nursing diagnosis is risk for injury are related to intraoperative error as evidenced by incorrect number of surgical sponges and sharps, and at the same time, a risk for infection related to improper aseptic technique. Okay, and of course, what we would like to happen or the outcome that we would like to have for this procedure is for us to maintain the sterility of the Mayo table and the Mayo stand all throughout the surgery, and at the same time, we go ahead and make sure that we have a complete number of surgical instruments, sponges, and at the same time sharps after the surgery. Okay, so that's it for the outcome. Now let's go ahead and go to the intervention. All right, so now let's go ahead and proceed with the intervention. So, of course, the first thing that we are gonna do is to make sure that we go ahead and drape the Mayo table. Okay, so our hands are protected in cuff of the drape. So, folds of the drape should be supported by our arms. Okay, making sure that our elbows are always bent. Okay, to make sure that, of course, the drape will not fall below our waist. And at the same time, we also make sure that we always maintain the drape in a high position, not until, okay, it is already in place into the Mayo table. Okay, so let's go ahead and do it. So let's go ahead and get the sterile drape. So because let's just pretend that we are all sterile, or we are already on a closed gloving and closed gowning. Okay, and at the same time, the drape that we are going to get is already sterile. Okay, so let's go ahead and get it. So this is the sterile drape. And all we have to do right, so already place the drape to its correct or proper place in our Mayo table. Now we're going to put another layer of drape to the Mayo table. Okay, and then of course we also do not forget to stabilize, okay, the Mayo table by placing our foot to the base. Okay, so we put our foot to the base of the Mayo table, and then now we are going to place and arrange the surgical instrument depending on the type of surgery that we're going to have, and of course the surgeon's preference. Okay, so let's first. Okay, and then after that, we go ahead and insert the scalpel blade into the knife holder, making sure that we do it in a dark downward position. Okay, we go ahead and just grab and insert the we go ahead and insert the blade, okay, into the groove of the holder. Okay, and then after that, we also go ahead and count the number of sponges, number of blades, number of needles and instruments that we have, while our circulating nurse are, of course, doing the counter check on their end. Okay, and then after that, we make sure as well that we go ahead and hand instruments, sponges, sutures, blades to the surgeon, depending on her or his preference. Okay, and lastly, for the evaluation, okay, what we would like to have is for our patient, okay, to be free from infection post-operative. So what we're going to do is we go ahead and observe the patient for any signs of localized infection 2 to 3 days post-operative. So that's it for today's return demonstration. I hope that you've learned something. Thank you, and I hope you have a wonderful day. Bye.